My name is Yaa Boateng, and I am a member of the Howard University School-Based Behavioral Health Program team. Today, I will be discussing how to manage grief and loss. I would like to begin with a short activity. Here we have 3 different situations. First, we have Maya, who is going through a breakup. Then, we have John, who is angry because he has to repeat the 8th grade. Lastly, we have Tyler, who is deeply saddened after a death in his family. Based on what you already know about grief, who do you think is experiencing grief? Actually, they are all experiencing grief. Grief can be expressed in many ways. It can be a deep sadness or a feeling of anger. The major difference between these expressions of grief is the time span that one may experience them. Some types of grief can last a moment, while others may last up to years. Grief is essentially caused by loss. This could be the loss of a person, or a place, or a certain feeling. Overall, this loss causes a major life change. Psychiatrist Elizabeth Kubler-Ross developed the stages of grief, which describe the process in which one experiences grief. These stages are shock, denial, anger, bargaining, depression, testing, and then acceptance. What may be wrong or problematic with these stages? Elizabeth Kubler-Ross's theory may be problematic because the term stages can be misleading. Stages insinuates that there is a specific path or process that one grieving may follow. Although one may undergo the symptoms described in these stages, everyone grieves differently, and there is no specific path to grief. Some common symptoms that one grieving may experience are anger, anxiety, despair, disbelief, fear, guilt, isolation, shame, shock, uncertainty, low self-esteem, insomnia, loneliness, and sadness. These are just some of many symptoms that one in grief may experience. Because grief is described as a deep sadness, it is commonly mistaken with depression. However, the two are different. With depression, getting a diagnosis and seeking help may be life-saving, while one experiencing grief is going through a natural reaction for their healing. Here are some differences in symptoms between the two. Here are some outcomes of grief. These are different than symptoms because symptoms are what we experience while grieving, where outcomes are conditions that may develop as symptoms persist. If grief is left unaddressed, these potential outcomes may develop. Although someone experiencing grief may feel as if they will never heal, there are healthy ways to cope with grief. Some of these coping mechanisms include acknowledging your pain, understanding that your grieving process is unique, leaning on friends and family, participating in your favorite activities, and remembering the difference between grief and depression. Your response is natural. A global pandemic may cause one to experience grief due to the major life changes occurring and the rise of sickness and death. Due to COVID-19, social distancing may change the way one handles grief. One should not break social distancing in an attempt to cope with grief. This may risk their health or the health of others. One can handle grief during a pandemic by calling or video chatting with friends and family, going outside, doing breath exercises, meditating, or praying. One should also try and establish a routine and maintain a sense of positive thinking. Keeping a journal can help reduce anxiety and process thoughts. It is important to recognize that grief is normal. Anyone may or may not experience it, and that is okay. If you are grieving, you may feel alone, but you are not. There are many people experiencing what you are going through. Also, everyone grieves differently. Do not compare the way you are grieving to someone else's grieving process. Lastly, I will test your knowledge with a little game of myth or fact. Do you think the following statements are myths or facts? First, we have the pain will go away if you ignore it. Do you think this is a myth or a fact? This is a myth. Grief must be recognized in order for a healing process to begin. Next, we have the feeling of grief can return after acceptance. Do you think this is a myth or a fact? This is true. Grief can return after the acceptance stage. There is no specific path to grief. It is completely normal for feelings to return. The next statement is, you have to be strong in the face of loss. Do you think this is a myth or a fact? This is a myth. There is nothing that you have to do in the face of loss. Your healing process is unique to you. Next, we have moving on means forgetting about your loss. Do you think this is a myth or a fact? This is a myth. Moving on means that you are healing. It has nothing to do with the loss that has occurred. Lastly, we have if you don't cry, it means you don't care or are not grieving. Do you think this is a myth or a fact? This is a myth. Not everyone cries when they are grieving. Thank you for watching this presentation. I hope it can help you understand grief and help you manage any grieving you are experiencing or may experience in the future.